Hello and welcome back to the channel. I'm Dr. Clara Nguyen, a wellness physician with over 20 years of experience helping people heal from chronic musculoskeletal pain. Today, we're diving into an important topic that affects millions of people around the world: herniated discs. Whether you're newly diagnosed, recovering, or simply trying to avoid surgery, this video is designed to empower you with food-based strategies to reduce inflammation, ease pain, and support disc healing naturally. Herniated disc, also known as slipped or ruptured disc, occurs when the soft center of a spinal disc pushes through a crack in the tougher exterior casing. This can irritate nearby nerves, causing pain, numbness, or even weakness. While medical care and physical therapy are crucial, nutrition plays an underrated yet powerful role in supporting spinal health and long-term recovery. Today, we'll go through 7 powerful healing foods, 5 foods to avoid, and practical daily tips you can use to improve your quality of life. Stay tuned until the end for essential cautions and a wellness wrap-up. Fatty fish. Let's begin with one of the most anti-inflammatory foods available: fatty fish, such as salmon, sardines, and mackerel. These fish are rich in omega-3 fatty acids, particularly EPA and DHA, which have been shown to reduce inflammation in the body and improve blood flow to tissues. In a 2006 study published in Surgical Neurology, researchers found that omega-3 South could be just as effective as NSAIDs for reducing back and neck pain and without the gastrointestinal side effects. You can enjoy fatty fish grilled, baked, or added to salads. For those who don't eat fish, high-quality fish oil supplements are an alternative. Aim for 2 to 3 servings per week. The key is consistency and quality. Always choose wild-caught over farmed fish whenever possible. Dark leafy greens. Next up, dark leafy greens like spinach, kale, collard greens, and Swiss chard. These vegetables are loaded with vitamin K, calcium, magnesium, and antioxidants that protect nerve function and maintain bone density. Vitamin K helps regulate calcium in bones and prevents calcification in soft tissues, both vital for spinal health. A 2018 review in Nutrients found that diets high in leafy greens were associated with lower levels of inflammation and better musculoskeletal outcomes. You can add them to soups, smoothies, stir fries, or steam them as a side dish. Don't forget a drizzle of olive oil to enhance nutrient absorption. Berries. Let's talk about berries, nature's colorful medicine. Blueberries, strawberries, and raspberries are rich in anthocyanins, which are potent antioxidants that help repair nerve damage and reduce oxidative stress on spinal discs. A 2017 study in the Journal of Agricultural and Food Chemistry showed that anthocyanins can modulate inflammation and oxidative pathways linked to degenerative disc disease. Snack on fresh berries, blend them into a morning smoothie, or sprinkle them over oatmeal. They're low in sugar, high in fiber, and support your immune system as well. Turmeric. Curcumin. Turmeric is one of the most studied natural anti-inflammatories. The active compound, curcumin, blocks inflammatory pathways and supports healing in soft tissue and nerve structures. A clinical trial published in Phytotherapy Research 2014 found that curcumin supplementation significantly reduced pain. In patients with musculoskeletal disorders, use turmeric powder in curries, soups, or teas. For better absorption, combine it with black pepper and a healthy fat like coconut oil. You can also take curcumin in capsule form. 500 to 1,000 milligrams per day is typical. Flax seeds and chia seeds. These tiny seeds are nutritional powerhouses. Both flax seeds and chia seeds are high in alpha-linolenic acid ALA, a plant-based omega-3, as well as fiber and magnesium. Magnesium is critical for muscle relaxation and nerve conduction. A 2015 study in the Journal of Nutrition found that magnesium intake was inversely associated with inflammation and pain sensitivity. Add a tablespoon to your yogurt, smoothie, or overnight oats. Just make sure to grind flax seeds for better absorption. Stay hydrated, as the fiber can be quite dense. Collagen and bone broth. Collagen is the main protein that forms the structure of spinal discs, cartilage, and connective tissue. Bone broth is rich in collagen, amino acids like glycine and proline, and minerals that support tissue regeneration. In a 2019 study published in Nutrients, collagen supplementation improved joint function and reduced pain in patients with degenerative joint disease. Sip on homemade bone broth or add collagen powder to your coffee or smoothie. Over time, this helps strengthen ligaments and cushion the spine. Vitamin C-rich fruits. Oranges, guava, and kiwi are bursting with vitamin C, which is essential for collagen synthesis. Without enough vitamin C, our bodies struggle to repair cartilage and connective tissue. According to the American Journal of Clinical Nutrition, vitamin C deficiency is linked to slower recovery in musculoskeletal injuries. Slice up these fruits for a refreshing snack or blend them into a juice with a touch of ginger for added anti-inflammatory benefits. Foods to avoid. Let's now shift to the foods you should steer clear of. First, fried and greasy foods. They're high in trans fats and inflammatory compounds that worsen swelling around the nerves. Processed foods, like canned meats and instant noodles, are loaded with preservatives and sodium, which contribute to water retention and pressure on the discs. Sugary snacks raise insulin levels, which in turn trigger inflammatory responses. Alcohol and excessive caffeine can dehydrate the spine and deplete vital minerals. High-purine foods like organ meats and some seafood increase uric acid levels, which can cause joint pain and inflammation. Caution and moderation. Even some healthy foods require moderation. Bananas, while rich in potassium, can aggravate certain spinal conditions if eaten in excess due to their sugar content. Dairy may trigger inflammation in sensitive individuals. Grapefruit can interfere with some medications used in pain management, so always consult your doctor. Balance is key. Moderation protects you from unintended setbacks while giving your body space to heal. Highlighted food. Turmeric. If I had to choose one standout food for herniated disc recovery, it would be turmeric. Its anti-inflammatory power is well documented, and it works at the molecular level. It not only reduces pain, but also aids in nerve regeneration. One of my patients, Linda, came to me after 2 failed attempts at back surgery. She began a daily turmeric routine, combining it with gentle yoga and bone broth. And within 3 months, her pain score dropped from 8 to 3. It wasn't a miracle, but it was consistency and natural care that made the difference. Conclusion and call to action. To sum it up, healing from a herniated disc requires more than just rest and rehab. It's a lifestyle change, and what you eat plays a vital role in reducing inflammation, repairing tissue, and maintaining strength. Start small. Add a handful of berries to your breakfast. Swap processed snacks for a collagen smoothie, or make a comforting turmeric tea before bed. If you found this video helpful, please hit that like button, subscribe for weekly health tips, and share this with someone you care about who might be struggling with back pain. Drop your questions in the comments, and I'll personally respond. Until next time, take care, nourish your body, and remember, healing is a journey, not a race.